Potassium-sparing diuretics. Diuretics increase urine formation by promoting sodium and water excretion without affecting essential nutrient reabsorption. They are widely used in treating edema and hypertension, as well as conditions like hypercalcemia, diabetes insipidus, and glaucoma. Air effect depends on drug structure, site of action in the nephron, salt intake, and extracellular fluid volume. They may also trigger compensatory physiological responses that influence their efficacy. What is kidney function? The kidneys filter blood, reabsorb essential substances, concentrate urine, and regulate water/electrolytes through hormonal control, ensuring fluid balance and waste excretion. Each kidney contains about 1 million nephrons. The nephron consists of glomerulus, filters blood, proximal tubule, reabsorbs essential nutrients. Loop of Henle, concentrates urine. Distal tubule and collecting duct, regulate water and electrolyte balance before urine is excreted. Key processes in urine formation. 1. Filtration. Glomerulus 20% of blood plasma is filtered into Bowman's capsule, forming the glomerular filtrate, excluding large proteins. Normal glomerular filtration rate is 125 milliliters per minute. 2. Urine concentration. Loop of Henle, descending limb, water exits, increasing filtrate concentration. Thick ascending limb, 20% to 25% of sodium and chloride are reabsorbed via the sodium/potassium/chloride cotransporter, maintaining the osmotic gradient. 3. Secretion and final regulation at distal tubule and collecting duct. Active secretion of acids and bases. Aldosterone and ADH regulate final sodium and water balance. Diuretics, potassium-sparing. There are two main types of these drugs, each with a different mechanism of action. Aldosterone receptor antagonists. Examples: spironolactone and eplerenone. 2. Sodium channel blockers, ENaC inhibitors. Examples: amiloride and triamterene. Drugs: spironolactone, eplerenone, amiloride, triamterene. Spironolactone, 7-alpha-acetylthiothioxo-1,7-alpha pregneforine 2,1, 17-carbolactone. 2. Eplerenone, 7-alpha acetoxy 3-oxo-1,7 pregneforine 2,1, 17-carbolactone. Mechanism of action. Spironolactone and eplerenone block aldosterone from binding to its receptor, reducing sodium and chloride reabsorption and promoting water excretion. 3. Triamterene 2,4,7-triamino-6-phenylpteridine. 4. Amiloride 3,5-diamino-6-chloro-N-diaminomethylidine, pyrazine 2-carboxamide. Mechanism of action. Amiloride and triamterene inhibit sodium channels, reducing potassium secretion and increasing sodium and chloride excretion without potassium loss. Structure-activity relationship of amiloride. 1. Effect of aliphatic moiety at position 5, R2, of pyrazine ring. Increases potency significantly. 5-N-ethylenisopropyl, amiloride, A31, and 5-N-methylenisbutyl, amiloride show affinities around 10 μm, similar to para and metaxylulonabisquinidinium. 5-N-ethylenisopropyl, amiloride, despite having only one guanidinium group, highlights the importance of the aliphatic tail at R2. 2. Effect of halogen at position 6, R1, of pyrazine ring. Presence of chlorine or iodine increases affinity 6-fold compared to hydrogen. Removal of the halogen decreases activity significantly. Future analogues should consider halogen insertion for improved binding. 3. Effect of aryl substitutions at R3, guanidinium group position. Slightly increases effectiveness compared to amiloride, However, affinity remains lower than EIPA. Adding an extra aryl ring at R1 or R2 does not significantly impact binding, e.g., a 35 versus phenamyl. 4. Effective amino groups NH2 at positions 3 and 5. Help in binding to sodium channels NACs through hydrogen bonds. Removing or changing them reduces the drug's ability to block sodium channels. Potassium-sparing diuretics uses. Amiloride combined with a thiazide or loop diuretic is used to treat edema or hypertension. Triantarene is useful in combination with a thiazide or loop diuretic in the treatment of edema or hypertension. Spironolactone is useful in treating edema resulting from primary hyperaldosteronism and refractory edema associated with secondary hyperaldosteronism. Eplerenone is used alone or with other diuretics for the treatment of hypertension or left ventricular systolic dysfunction and congestive heart failure after myocardial infarction. Major drug interactions. Number 1. Potassium supplements and potassium-sparing drugs. The drugs are potassium chloride, spironolactone, eplerenone, amiloride. How they interact. Increased potassium retention raises the risk of hyperkalemia, leading to cardiac arrhythmias, muscle weakness, and paralysis. How to manage. Avoid combining these drugs or monitor potassium levels closely. Number 2. Angiotensin converting enzyme ACE inhibitors and angiotensin II receptor blockers ARBs. The drugs are lisinopril, enalapril, losartan, valsartan. How they interact. These drugs reduce aldosterone secretion, decreasing potassium excretion and increasing the risk of life-threatening hyperkalemia. How to manage. Monitor serum potassium and renal function closely. Number 3. Nonsteroidal anti-inflammatory drugs NSAIDs. Drugs are ibuprofen, naproxen, celecoxib. How they act. NSAIDs reduce renal prostaglandin synthesis, leading to decreased renal perfusion and reduced diuretic efficacy. They also enhance potassium retention, increasing the risk of hyperkalemia. Management. Avoid prolonged co-administration, monitor renal function and electrolyte levels. Number 4. Cyclosporin and tacrolimus. How they act. These immunosuppressants cause nephrotoxicity and potassium retention, which can exacerbate hyperkalemia. Management. Monitor kidney function and potassium levels regularly. Specific side effects. Spironolactone can gynecomastia, breast enlargement in men, due to its hormonal effects. Eplerenone less hormonal effects but may lead to hyperkalemia, high potassium levels, more significantly. Amiloride cause gastrointestinal issues such as nausea and diarrhea. Triamtarene can increase the risk of kidney stones due to its effect on electrolyte balance.